Hi, my name is Breanne and I work for the Canadian Mental Health Association. Today I'm here to talk a little bit about what we've been through over the past year and how our mental health has been affected. This past year, the COVID-19 pandemic played a huge role in our community's mental health. I don't think any of us really anticipated the impact that two little words could have on us. The mantra that we adopted was stay home, but stay home meant something different for each and every one of us in our community. For those of us who live alone in Medicine Hat, staying home meant that we were lonely. We didn't get to connect face-to-face with others anymore, and we struggled with that. We also took on different roles this year. For those of us who had children who were school-aged, when the schools shut down, we became parent and teacher. We became very conscious of the people who are coming in and out of our house, in and out of our offices, in and out of our stores. All of that increased our stress. Our finances became a concern as well. Due to the restrictions put in place to keep us all safe, some of us lost our jobs, some of us had our hours cut back. Media was everywhere, and it seemed for a while like all we could talk about was COVID-19. How many of us sat watching the news for the number of cases and the number of deaths? The media reporting about COVID-19 did a number on our stress. Some of us felt fearful, some of us felt sad, some of us might have even felt angry with what was being reported. We also learned new ways of working this year. Some of us worked from home, some of us worked from a workplace, and some of us did both throughout our work week. We did our best to adapt to the changes by doing things like having meetings via Zoom, but how many of us are feeling a little bit of Zoom fatigue right now? We experienced a lot of loss as a community this year. We lost people to overdose, we lost people to suicide, we lost people to sickness. But we didn't just lose people this year. We also experienced loss of safety, loss of security, loss of self-determination, loss of mental wellness. A lot of people that I had contact with over this year spoke about depression, anxiety, and loneliness, and they said that these things had changed for them since the pandemic started. I know what you're thinking. You're thinking, oh my gosh, Breanne, this all sounds so negative. What else did we do this year? Was it all just bad? And I'm going to tell you that no, not everything was bad this last year. We had some good things happen. We learned a lot about ourselves and our resiliency. We had some great programs developed for our community this year. Keep in Touch is one of them. This program pairs a volunteer with an individual who might be experiencing loneliness and isolation. Social connection is a huge way that we can help keep ourselves mentally healthy. Being outside in nature has huge benefits for our mental health. Over 80% of us in Medicine Hat this year said that our municipal parks played a huge role in our personal wellness. So where do we go from here? We know this year that we struggled. We know our mental health hasn't always been the greatest, but we also have learned and built resiliency. I think before we look to the future, we need to focus on the present a little bit. As of right now, we are still in a pandemic. We are still following restrictions. Our stressors from last year still exist this year. As we look towards the future, we need to be able to make sure that we are still taking care of ourselves. It's important that we continue to reach out to programs that were developed to help us combat loneliness and isolation last year into this new year. One thing I always talk about whenever I talk about mental health is the importance of reaching out for help when we need it. Sometimes people don't recognize when they need help and don't think to reach out. At that point, it's our job to reach into them to get them the help they need. Appreciation and gratitude are things that we can use to help us focus in on what really matters. So, from me to you, thank you. Thank you for being exactly who you are. Thank you for being a community that cares, and thank you for wanting to understand more about mental health.